Each patient arrives with very unique qualities, and assessments are done through each of the streams in the Program Services Department, and a treatment plan that is presented to the core treatment team is then applied for each individual patient. First and foremost, patients can be quite reserved and quiet, and then as they progress through the system and through some of the social skills training and activities that they're involved in, they just become more confident and more able to progress and be in charge of their own treatment direction.
Program services is divided into 3 areas. There's occupational, vocational services, leisure services, and health and wellness. And there's a variety of programs that are involved in each of these 3 areas that facilitate community reintegration for the patient. OT is here to help patients learn living skills that facilitate them managing and avoiding stressful life situations, because stressful life situations can trigger psychiatric relapse. It's helping them relearn old skills they may have, as well as learning new skills associated with living, such as budgeting, banking, and food safety. Some of the vocational programs that we have on site are programs such as recycling. Computer skills is a really important one. Many of our patients don't have those skills. And in addition to that, we offer educational upgrading or schooling upgrade to assist patients to get their GED, to support them in the workplace settings. Leisure time is often challenging for patients, and in order to do that, you need to have a variety of social skills, and you need to know how to structure your time in very pro-social ways. Usually patients start when they're admitted by going to our gym program, and then from there, as their symptoms improve, they get more involved in a variety of recreational activities, including participating in a clubhouse model. We offer a variety of health education programs, usually group programs such as sex education, medication and mental illness management. In addition to that, we have group counseling programs that focus on how patients manage emotions, such as anger and anxiety. Well, most of our patients, we estimate about 80% have a concurrent disorders. What that means is they have a mental health disorder, such as schizophrenia, and they also engage in problematic substance use. We do an assessment to match the patient to the programs that best suit their needs, which include a variety of interventions with an emphasis on interventions that are most evidence-based, meaning ones that are known to be most effective for our clientele.
The role of the chaplain is to help each person meet their own spiritual needs. If you're a Roman Catholic and you want to see the priest, then I phone the priest and he will come down and meet with you. Recently we had the Muslim imam come over and work with a patient. We have native elders who come in once a month, and we have our native brothers and sisters who will meet with them. What I try to do is go from ward to visit and to meet people, and that's mostly what it's about. It's giving people some time and listening to them. The people often will just drop by my office, pick up the guitar and start playing it, and then we talk, and then they go. It's just a connection.
What we try and provide at Hawthorne is a all-encompassing health and wellness focus of the patient as a complete individual. So our daily plan and our programs are designed to help them assimilate and to move into the community. When the patients are at this point where they're ready for discharge, it can be a very stressful time. So what we try and do is provide support and direction in all the various aspects of community living while they're here and supervised, so that we can monitor how they're doing before they actually go out into the community. And then each individual treatment team will focus on what areas the particular patient needs support in. We do budgeting, money management, medications, safe sex, and health-related topics, anger management, and education about mental illness, physical exercise, and healthy lifestyle. Also, to educate them on healthy eating and healthy dietary choices. They should be quite actively involved in their discharge plans and where they expect to go. if that's through the vocational placement, and then also have an idea of what kind of residence that they're going to be moving into. And they actually spend a large amount of the time in the community on a regular basis. By practicing here and getting feedback from the nursing staff, it further educates them of what areas that they need to really work on in order to stay in the community.